On the side. Does that feel comfortable? Okay. So yeah, it's already telling me if my client try to readjust something. So if he's not comfortable, he's already going to tell me something going on with the postural. Okay, of course, we do assessment. What is that?
You want me face down?
Face down, yes. Is that comfortable?
Yes, it's good.
Okay, on the side. And guess what? We can also do those muscle testing when customers is lay down like this. Also, what I'm doing here, I'm not put the bolster. I'm not rushing to put the bolster. What I'm doing here, I'm pointing those foot inside, so they touching each other. And and I'm even sometimes I even ask you, do you feel any like tension in your leg when I put pointing out, pointing in?
No.
Okay. So now when I'm looking here, I'm looking at that spine. Look at this. It's around it. This left side muscle, erector muscle, is a bulky. Yeah, the right one is really bulky. So I'm already paying attention. I'm not just put the person on the table and start doing this. Yeah, more oil. Let's put the more oil on him. So what I'm paying attention. Okay, this is bulky. This is already telling me something. Rounded. Of course, I'm gonna put the bolster now for comfortable of my clients. And what I'm doing here, let me add this camera too now. Okay, should be good. Okay, so what I find out, this is bulky. We have that nice treatment, and at the same time, it's a kind of muscle testing the spine. It's called spinal roll or lumbar roll. This is called tuning fork. So tuning fork, you put it together. You see my two fingers together like this. Open up, it's create that fork. What I'm doing here, I'm apply pressure. I'm not apply pressure on the spine. I'm apply pressure on the side, and I roll him to the left, to the right, and I roll him to the left. And I see which way is a rolling, like problems with the rolling. Which way, David? I'm already know it's going to the right, correct. So to the right, because he's probably walk with this pattern. This hip is constantly forward. So it's already telling me, even if you don't see that bulky muscle, but you will see it sometimes. And you start rolling this way and that way. You can also change the sides. I'm doing this because the camera, and what I'm doing here, I bring this to the first barrier. He's breathing up here, right? He's breathing. I try to relax. I'm not rushing myself. And look, he's already start changing. We showed this many times. Now, if you know our class, if you visit our class, if you're watching our video, you apply the next tool, which is more advanced. You lock that sacrum, pull him, grab that ilium with the straight arms without any like a hooking, and gently pull him to the next level. Hold him up here. Your arms are straight, your back is straight. Ask David to push down towards the table. Relax, let it go, and I give him more slack. You're probably going to see on this camera. And let it go. Look at that. Look exactly. So I'm already correcting this postural. Look at this. This bulkiness is go away. Why? Because we release that tension. And look, I can roll him here and here almost equally. Do I need to work hard here? Do I need to get this elbow and doing this and doing that? And maybe, I don't know, people love that, but this was super effective. And person was relaxed, because if I'm push too hard on that lumbar area, he's already have a little bit inflammation up there, maybe some disc problem. What's going to happen? He's going to guard it. He's going to guard it. He's not going to release it. He's going to feel good. He might fight with you for a couple minutes, but this is the most fast way to get that customers in relaxation mode. So also, as you remember, we have that Let me get my oil. Again, someone took the oil. All right. No, I got that muscle rub. Okay. Like I said, I'm talking about why we use the specific treatments from our book, from our Life Rex book, which is helping customers relax right away. We remember that posterior line, it's constantly pull because we slouch forward. So posterior line is always, it's like pull this energy up, not down. So what we're doing here, we want to release, and this is my speed. I get that erector spinae muscle. You can use your thumb, you can use your knuckle, you can use your palms. This is what I do. So I hook that fascia, and you look at this. The fascia is not moving at all. So when I pull that fascia down, it's not pulling at all. So it's stuck. What I'm doing here, this is my speed. I'm trying to glide and release that. This is more like a fascia work. Very light in principle. This is my speed. And I look at the same time how my client is breathing. So I ask him to breathe deep. Which rib is rise more and pushing against me? If I push on the left and it's telling me, yeah, keep breathing. And relax. So what I'm feeling here, we've just been talking about this split meridian, all this area between your mid trapezius and your lower trapezius. It's really, really kind of, I can feel on the right side. You feel that too? Mm-hmm. So yes, I'm going to work on that area very, very deep and slow. In this case, I'm going to start using my thumb. My thumb is going to navigate at that laminum groove. So I found that laminum groove, and all I do, I just slowly down. This is my speed. How's the pressure? Good. Pressure is good. So I'm not pushing hard. You see, I use my body weight. I don't use my arms. I'm leaning to this area, and I drive through all the way down to T12. So that's what the physio massage, this is what the medical massage, you truly work on that issue and problem. And guess what? Even if I find out that some vertebrae get tweaked or twisted, what's going to happen? It's going to push me away from that laminum groove. So I'm going to work deeper in this area. And what I feel right in here, you feel that? Mm-hmm. I do feel that too, because I don't rush myself. Now think about if I'm doing this. This is what the... Is that gonna help my clients? No. The idea is to put in his head, hey, something right there, something in this bone, and he thinking about this. I'm focused on that, the communication, and you're gonna start correcting that. So right in here. So I found that stop up here. I'm start asking to breathe. Just please breathe for me. Exactly. So he's breathing deep and slow. Don't need to rush anywhere. And this is what he's doing. Look at that. I use my thumb on that side. The left side is no problem. I don't feel anything. So I'm focused on that. I'm light up here. I don't want to push on the kidneys. Kidneys close. And relax. Next one. Yeah, I do it again. Here we go. We still have a problem. So I can still feel it. So what's this could be? Well, let's try add some. I don't think it's going to be shoulder, but what I want you to do, I want you to get that arm and start moving like you reach something up. So I'm going to stay away always. Go ahead. So here we go. He's moving. Do you feel that more now?
Yeah.
So he feel that. So every time he's moved that shoulder and raised that shoulder, this is affected. I can feel that. My fingers, it's pop. How's it feel? Slowly, yes. So through the motion, that's what the physio massage is. If you give him the band, if you give him all that stuff to work on, he will reactivate more. You put some ball under his shoulder, and that's the key. Don't rush yourself. Massage is not, it's not about this, like I said, spreading oil. It's all different type. Swedish massage, it's in the past. All this stuff, it's good. I didn't say it's a bad, but it's not do a lot. This is more deeper, more specifically on that problem, on that pain. Because look, and it's get what? Smoother? Laminum groove.
You're not working on the muscle right now.
Yes, I do work on the muscle because we got so much. Look, this is what happened to him. His vertebra is probably doing this. You see? His vertebra is like rotated this way. So when I work on that laminum groove right in here, I get that. I feel that the spinal process. When I push it on him, he feel that. He start moving, and it's getting better. We can put him on an extension, flexion, and find out which exactly movements. It's probably going to be flexion or extension of the spine. So the next one, I keep working on that. I get his arm right in here like a cobra position, and I teach him to find that area. You don't, if you miss it, I mean, if you take your hands off, explain what you want to do, it's okay just to work on that area. So not like individual spot. So start raise your head up, try to extend and look up towards the ceiling. And try to look at the ceiling and down. Look at the ceiling and down. Look up. You feel that right there? When he start extend his spine, I feel this one is push my finger off. So what I'm going to do up here, I'm going to hold that spot, and he's going to look up and down. Exactly. Up and down. What do you feel?
It feels just relaxing.
Yes. You feel that one? Something just little pop. Do I need to do all those manipulation, all this like adjustment like a chiropractor do to correct that? No, because I want this guy was safe. Like, hey, I don't want to put him in the fear, because if I'm start doing like some manipulation or like doing that kind of stuff, he's try to guard it. But this is slow motion, and focusing on that area is gonna help a lot because he start understanding what's going on. Also, remember this rounded back. We get this nice twister. I think Eric Delton showed me that one. So I really like to do on that side, but that's okay. I'll show you for the camera. So I grab that fascia, place my hand, my palm, and I pull that fascia down. This one is kind of opposite, like a yin-yang, and also push this direction. Now I'm start to ask him breathe, and I'm apply the pressure directly down and a little bit twist. What I'm doing with this little twist, I want to lock that spine, those facets down. Very light. I don't push hard. I see a lot of people like start getting with the knee on that area. No, you don't want that. You don't want that. If this is 300 pounds guy and you are 50-pound girl, probably, but so inhale, exhale, always focus on breath, because a lot of people don't know how to breathe. So I teach them to breathe and relax. You see, and this is take time. And you can walk around, it's no problem. Walk around this way. Take a deep breath and relax. Do I push hard? No, I'm apply 10, 15 pounds and get a little bit more deeper and deeper. So he relaxed more. If I'm going to do this, what's going to happen to him? He tightens up, yes. And he might get injured. You might injure him because, first of all, you're not a chiropractor. You're not supposed to do any adjustment. And also, you don't know what's going on under with those vertebrae. So you need to not cross your scope of practice. But something similar, which your scope of practice, you can do that. So I feel that ribs is up there, and I work in his breathe. And another.
You're doing that, is it clockwise or counterclockwise?
Yes, it's all different directions. But my idea is pull that fascia down. Remember, look at this. You see that fascia, and it's stuck right in here. Yeah. It's getting better. I can feel that movements because the fascia, you want to do more fascial massage. Here, between that between that shoulder blades, trust me, you want to do that fascia work. You want to make sure that's movable up here. Because remember, this muscle is overstretched. They're weak. So you want to give them more movements and give them homework with the bands. That's why we hold the bands all the time. I'll show you another exercise for actually this area. Let me show you that move. So this is what I want to tell. This is what's the difference between regular massage and physio massage, or even kinetic physio neuro training massage, that kind of new generation. This is 2025. This is going to be the booming. That's going to be next generation of massage, new era. So that's what I want to talk about. Okay. What else, David? And you can do.
And
That's fine.
I mean, sometimes like I can't. It's hard for me to activate these muscles in here. Like it goes like as a unit. Like when I
Okay.
try to bring this, it all comes up as a one.
Okay. Yeah. He's struggling. Let's fire this up.
When I do exercises in class.
Okay, he's doing exercise in class and he experienced some, it's hard for him to bring that muscle. It could be the problem with the shoulder positioning, or it's not muscle active. So we give him one strap.
Oh, okay.
He's holding one strap and all he's going to do, kind of raise it up and stretch the band. So stretch. And what I'm doing here, I'm pointing inside. You see, I grab that fascia and I'm pointing. You can do knuckles. You can retest it. Stretch. Try to pull up. There we go. Look at that. I can do this. Pointing down. Push your arms down. Push down. You see, I'm already reactivate. I can come up here with one arm. He's pushed down. And the other arm, let's try to reactivate it. How's it feel?
Yeah, that feels good.
Exactly. So that's why you know kinesiology. You know which muscle it is. It's also pecs working right now. This is active. Push down. Relax. Push down. Relax. Also, he can stretch the band, work on the pecs, and it's going to be the work. Okay, let it go. Try to do it now. Try to get some. Look at that. You can also get the band up here, down. Look, he's holding the band in his hand. You step on it, so create a little bit tension. I step on the band. Let me show on that camera. Let me show another camera, another side. So because that. Yeah, easy to see what I'm doing. And like I said, you will learn. So get around that arm, get that band, step on it. So make sure it's going to be tension already. So step and start. He's going to be raise up and down. If this is too much, grab some other bands. Go ahead. Yeah. You can help him. You can say, you see my other arm? And all that kind of stuff. He's feel that muscle. Push down. Relax. So the band is a feedback loop to that muscle. And if you guys start using these bands, the tools during your massage, you will tremendously help your person. Because I know people lazy, they don't want to do anything, they just want to lay down and they think it's going to be corrected. No, it's not. So they need to do homework too. And I stop wasting time on people who don't really want that. I want to people come in, they're crying, I want to go back, I want to move, I want to do my everyday routine, and I tell them, okay, you need to do this, this, and that. Guess what? They never done this. They just want me to do the job for them, and they think it's going to be work. No, you have to set up their mind. They have to do the job with you, and it's going to be more productive. If not, it's not going to be therapeutical. And guess what? People are going to come back and they're going to say, "Oh, this guy, it's never worked. It's never worked. The massager was like, the therapy is not working." Yeah, because they never done anything. So you did this work, and they feel good for a couple days, they don't do any exercise, any muscle activation on their own, and that's the problem. Look at that. It's already released that bulkiness in the muscle. Look at that. I can move stuff around. Look at that. It was stuck. If I put so much oil, what's going to happen? I'm going to work only on muscle, and fascia is going to be there. It's going to be the same. Okay? Try to bring like you asked me.
Yes.
Yeah, the arm. Look at that. He's
Better, way better.
look at that.
Yeah, it doesn't feel like
5 minutes work already changed tremendously. Like I said, we can flip him up, working on those pecs, open those pecs muscles, and yeah. One more key. So to turn face up. So when people come in and they're very tense, they like computer guys, doctors. The head is right there. So your client is like right in here, and he's holding his head. He don't know about it. He's like this, and he said, "My neck is in pain, and my back is." What's gonna happen? You need to relax him. So this is what I usually do. I hold that head, and just move him around. Trust me, 2-3 minutes, sometimes even 5 minutes. They holding it, but they start doing relax. Also, I place on the chest. Yeah, exactly. Ask him to breathe each breath, and the mission is to get him on the table. And a ton of people after 70s, they all like this. They all that question mark. So here, and guess what? What are you gonna do to them? I mean, massaging is help for a couple of days, but after they still come back because they sitting like this, they driving like that, and it's always be that way. Till you start giving the homework, bowl, squeeze the bowl against the floor, do wall angel exercise, and all this stuff. We've been talking about this many times. All right, let me show homework for him. That's great exercise. I want you to lay down on that side. No, other way. Yes. So I want to show it to him. This is the big band. We need 2 bands. This is great exercise. So I ask, remember this spine is rotated to the right. He's hard to rotate to the right. So that's what we're going to do. We're going to go through the legs then. So you get that band. Inside the band, go all around, so he's got to lift himself up. There we go. And you will find that area, which is, you can work from all the way from the sacrum all the way up to T12. So what I'm doing here, that band I'm apply and not allow him to rotate. So here I can wrap around me. So you see, is really not going anywhere. Give him this band, grab with the both hands, your arms is forward, and all I want you to do is start stretching a little bit more. Less, grab this last band. Here we go. Maybe a little bit more is going to be. So what he's doing, we teach him to rotate that spine without editing this lower back. Go ahead and try to rotate and look.
That's a heavy band.
Heavy, grab 1 strap. Always 1 strap, not 2. This is my every morning strap band. Try to look. Always see where you're going. All the way down. I want you to go all the way down.
My God.
Okay, remove that pad first. Your head is on the floor. So now rotate it. And try to look. No, I want you to go more.
That's it.
All the way down. Try to turn your head too. You see, he's not turning his head. I teach him. Okay, here we go. Now, okay, here we go. You see, when I release that lower back, he started rotated whole back. I want him to teach only to rotate this thoracic area. I can hold that. Rotate more. If you don't want to use the band, if you don't have a band, both hands right here, one hand, and when he's rotate, you try to apply that to the rib cage, to that shoulder. So we want that rotation. But you see, I'm hard working now. I want that easy. Yeah, because, and look, he's getting there. He's getting more and more. So we have thoracic mobility problem, so we have to work on that. If you're going to massage him, is this going to help? I don't think so. Yeah, is that bandage stuff or what? Or you stuck up
tight.
here? Where's the tight? In here?
It's tight. It feels like right
Exactly.
here,
So you see?
like there's a little knot or something.
Yeah.
It won't let me go past.
Now look, do without my help. He's gonna cheat.
No, without your help, I don't cheat. There.
You see? So we need to do all this kind of exercise on the floor. Remember, rotation, rolling exercise to find out what's going on with this guy and try to help him. And guess what? People is going to come back to you all the time because you truly help them. They truly see the effect. If you just massage them, if you just spread the oil around, they feel good, but in 2-3 days, they get this feel the same. And if your price is, I mean, people come back to you if your price is low, but if your price is a good price for massage, they will never come back to you. You need to sell your knowledge, you need to sell the health, and that's